Are you looking to get rolling with your marketing but either don't have a big budget or don't know where to start? Stay tuned because that's exactly what we're going to go over in this week's tip. Good. So you're ready to start marketing, but you don't have a ton of budget and you're not really sure where to start because there are so many different things that you can do marketing-wise. Here's what I have found has worked the best for our clients in doing this year in and year out. We're going to focus on 4 things that you can do right now to start seeing more new patients. Okay, so the first thing we want to make sure that you are doing is getting those word of mouth referrals and especially scheduling the friends and family of your existing patient base in. We already have plenty of content on that, so make sure you check out those tips. I definitely wanted to go over that point because it is something that you can do that does not cost you a cent and will result in plenty of new patients month in and month out. Number 2, also cost effective in that it's free, is making sure that you're getting reviews. You want to constantly ask for and get reviews every day and every week. It not only helps to build social proof that you are a great office to go to, but also every time you get a review and you keep that flow consistent, it actually helps with your search engine optimization, meaning you're going to come up, or you're likely to come up higher in the search results when somebody is searching for a dentist near you. So again, that's a really great way to improve your visibility and let people know about you and how great you are without costing you anything. So once you have that in place, there's 2 places that you can go from there. You can do Google Ads, which is your pay-per-click advertising. You can also do direct mail marketing, and I'll talk about those 2 options and sort of the general cost associated with each. For a pay-per-click marketing campaign, if you're paying a management company to do that for you, you're usually going to pay a fee that ranges anywhere between $800 and let's say $3,000 to $5,000 per month for them to manage your campaign. You definitely don't want to go with the cheapest out there because you do get what you pay for. That said, that management fee is separate from your marketing budget, which pays for the actual ads on Google. So your marketing budget is typically going to range anywhere from, on the low end, probably $1,000 to on the higher end, $5,000 or $6,000 per month. It's perfectly fine to start on the lower end of that budget with your marketing company. Just make sure that you're in really good communication with them regarding the results you're anticipating or would like to see, and that there is a plan for you to increase that marketing budget over time. The expectancy isn't that you stay at the lower end of that spectrum. We definitely want to increase your budget so long as we're getting really good results with that marketing campaign. Your marketing company will also tell you for your area what makes the most sense in terms of ad spend. Sometimes if you're in a really urban area, that ad spend could be $3,000 to $6,000. Maybe that's not so feasible for you at that time. What you could start with is a direct mail marketing campaign. Generally speaking, the best protocol is to send 10,000 postcards per month and to do it through a company that does mass mailers so that you keep your costs pretty low. And you want to make sure they handle everything from start to finish. It just keeps it really clean and simple for you. But if you do that, you'll typically see results of about 7 to 12 new patients on the high end per month. That's with about a $2,000 to $2,500 budget. It's a pretty good return on investment, and it will help you get started with your marketing without spending very much money. So that's my tip on what marketing to get started with. I know there's a ton of other things that you could do like TikTok and Instagram, Facebook. Those platforms are great, but they're not really great in terms of generating new patients right away when you don't have your basics in place. So focus on your basics, get those in place, and then later on, if you already have 30 to 40 new patients per month, if you want to start exploring that option, you can. Speaking of getting your marketing basics in place and much more, make sure to attend our new patient workshop. We cover all the basics of marketing and essentially every other type of marketing that a dental practice can do. along with what to do with that new patient inflow. So you're going to be spending money on marketing and generating new patient leads. You definitely want to make sure that they're converted. And that is a big part of what we cover in our new patient workshop. So you definitely don't want to miss it. We'll put a link in the description to that workshop along with a free ebook that will help you with your new patient marketing. Thanks for watching. If you like today's content, make sure to hit the subscribe button. We'll see you next week.